Hello, I'm Professor Sally McCarthy. I'm the President of the International Federation for Emergency Medicine, and it's my pleasure to present the IFEM Awards today. Each year, IFEM recognises special individuals who have contributed to international emergency medicine through their outstanding work leading to improved emergency care. Today, we're recognising recipients of the Humanitarian Award and the Fellowship of the IFEM Award. The purpose of the IFEM Humanitarian Award is to recognise an individual or organisation that has conducted work related to international emergency medicine which has led to major humanitarian or public health benefit. Our first recipient is Dr. Srihari Kadamchi from the Society for Emergency Medicine, India. Dr. Kadamchi's academic and professional focus is on emergency and disaster medicine, humanitarian assistance, clinical research, and public health. Dr. Kadamchi has contributed towards the development of emergency medicine, community first responders, disaster medicine, and pre-hospital care in India for more than 13 years. He has also directed and joined post-disaster and humanitarian crisis responses in many global regions. In 2017, he joined the ICRC in Geneva and deployed as a health delegate in Gaza. Dr. Barry Klaassen from the Royal College of Emergency Medicine is recognised for his work in Malawi since 2010, establishing the first adult emergency and trauma centre at the Queen Elizabeth Central Hospital. He later obtained a Scottish Government grant for over £1 million to develop emergency and trauma centres in other central hospitals across Malawi, aiming to develop a national network of emergency care in conjunction with colleagues locally and to measure the impact and effectiveness of this initiative. He is actively involved in the Scotland-Malawi Anaesthesia Project, training clinical officers and nurses in Malawi, and is Chief Medical Advisor to the British Red Cross. Dr. Rosanne Scaliki from the Australasian College for Emergency Medicine has dedicated her professional and personal life to the advancement of emergency care in both Tanzania and Myanmar, and has been pivotal in establishing emergency medicine in Myanmar. In 2009, Dr. Scaliki took her young family to northwest Tanzania to a 200-bed district hospital to develop an emergency department and improve emergency care. In 2013, she went to Yangon to help train the first local emergency medicine specialists and introduce the system of emergency care to Myanmar. Over the last 7 years living in Myanmar, this has expanded to a university Masters of Emergency Medicine training, Diploma of Emergency Nursing, Triage and Ultrasound training, and Basic Emergency Skills training. Dr. Scaliki continues to advocate for Myanmar physicians and healthcare workers and provides support to them since the recent coup in Myanmar. Now we turn to the Order of the IFEM Awards, also known as Fellowship of the IFEM, which recognises individuals who have demonstrated an extensive and continuous commitment to the specialty of emergency medicine in their own country, as well as having made significant contributions to supporting the development and advancement of the IFEM. This can be by serving in a leadership role within the IFEM, or demonstrating outstanding service in promoting the development of the IFEM, active involvement with ISEM, or by demonstrating outstanding service promoting the educational objectives of the ISEM, or an exceptional person who has made outstanding contributions to international emergency medicine in other ways. Today we present 10 awards. Our first recipient is Dr. Elizabeth Devos from the American College of Emergency Physicians. Dr. Devos has been chair since 2018 of the IFEM Specialty Implementation Committee and involved with IFEM for some years before that. And she is active with ASEP's Ambassador Program in International Section. She also remains active with an ongoing involvement in emergency medicine development in Rwanda and is recognised as a global emergency care educator by the Ministry of Ghana and the Saudi Arabian Ministry of Health. Dr. Saleh Faris from the Emirates Society of Emergency Medicine was the founder and president of the Emirates Society of Emergency Medicine since 2012, established the Emirates Society of Emergency Medicine Conference, and helped found the Gulf Federation of Emergency Medicine. Dr. Faris is founder and chair of the Trauma System Initiative of the Emirate of Abu Dhabi, including the Trauma Registry, and he is chair of the organising committee for this conference, IFEM 21, and a current IFEM Assembly member. Dr. Goh Siang Hong from the Society for Emergency Medicine in Singapore helped establish the Society of Emergency Medicine in Singapore and achieved specialty recognition by the Ministry of Health and Academy of Medicine there. He is a founding member of that society and was its president from 2005 to 2012, during which he hosted the ISEM in 2010. Professor Goh was a member of the IFEM Assembly. Dr. Colin Graham from the Hong Kong College of Emergency Medicine moved from Glasgow to Hong Kong, becoming a Fellow of the Hong Kong College and the Academy of Medicine, and has many other academic affiliations internationally. Professor Graham has made major contributions to academic emergency medicine development and research, clinical care and emergency medicine education, including as editor-in-chief of the European Journal of Emergency Medicine for 10 years. He is a member of the IFEM Research Committee and other IFEM task forces. Dr. Tajek Hassan has championed the development of emergency medicine, leadership and workforce sustainability since qualifying as a consultant, and has been active and leading educational initiatives in Pakistan, India, Sri Lanka and parts of Africa. He was the Director of e-learning at the Royal College of Emergency Medicine and is a past president of that college. He is current IFEM Assembly representative, or is current IFEM Board representative and a past IFEM Assembly representative. Dr. Camilo Gutierrez from the American College of Emergency Physicians is the chair-elect of the International Emergency Medicine section of ACEP and the ACEP Ambassador Program. He's also involved with the Global Emergency Medicine Academy of SAEM and the AAEM International Committee. He is a founding member of the Latin American Pediatric Society and chairs the IFEM Pediatric Emergency Medicine Special Interest Group. Dr. Don Milady from the Canadian Association of Emergency Physicians is an academic emergency physician with a special interest in geriatric emergency medicine. He established a clinical fellowship in geriatric emergency medicine in Canada and has developed key resources in the subspecialty available to the global emergency medicine community, and he educates for geriatric-friendly EDs. He's a founding member of the Geriatric Emergency Medicine Special Interest Group established at IFEM in 2014 and is current chair of IFEM's Clinical Practice Committee. Dr. David Taylor from the Australasian College for Emergency Medicine is being recognised for his contribution to emergency medicine research at a national and international level. As chair of the IFEM Research Committee from 2015 to 2019, he developed the IFEM Ethical Conduct in Research Checklist, a white paper on ethical challenges in emergency medicine research and peer-review protocols. He has contributed to the research content of many international conferences on emergency medicine. Dr. Judith Tintali from the American College of Emergency Physicians has spent her entire career devoted to teaching and leading the development of emergency medicine around the world. She has had numerous leadership positions, speaking engagements, and really needs no introduction. She is the author of Tintinali Emergency Medicine, which is the best-selling emergency medicine textbook of all time, and she is one of the most accomplished emergency physicians in the world. Dr. Yana Stupescu has spent his career advancing emergency medicine, including setting up the inaugural residency training program at the University of Wisconsin School of Medicine and Public Health. Yanis was instrumental in developing emergency medicine residency training at Addis Ababa University in Ethiopia, which was one of the first training programs on the African continent in emergency medicine. He is active in the Global Emergency Medicine Academy and ACEP International section. Dr. Tupescu is Deputy Chair of IFEM's Core Curriculum and Education Committee and a member of IFEM's Executive. On behalf of the IFEM Board and Assembly, I'd like to congratulate all our award recipients and celebrate their remarkable achievements and commitment to international emergency medicine. Thank you.